Hello, my name is Kate Kellum, and this is my patient, Raylan Little.
Hello.
And she presents with hypokinetic dysarthria. And hypokinetic dysarthria is a motor speech disorder it results from damage to the basal ganglia, and it affects slow movement and limited range of movement in all aspects of speech. So I'm going to demonstrate some behavioral tasks that will help her to communicate her speech more effectively. So the first area that we're going to focus on is her articulation. And this area is the most common deficit for hypokinetic dysarthria. It results in imprecise consonant production. So slowing the rate of speech can improve her articulation by allowing her articulators, so like her tongue and her teeth and mouth and lips, to reach allowing her articulators more time to reach those target positions. So the slower the rate also gives her more time to think about what is being spoken. So we're going to focus on a task called hand or finger tapping. So I'm going to say a sentence, and I'm going to tap, and each time I tap, she is going to say the word after me. So, Raylan, so what we're going to do is we're going to do a thing called hand or finger tapping. Okay. And I'm going to say, could you just say a sentence? We're going to say, we're going to do the happy birthday to me. Every time I tap, I want you to say the syllable. Okay?
Okay.
Ready?
Happy birthday to me.
Perfect. Good job. So you can see how that helped you slow your rate of speech and get all of your articulators where they needed to be with each of those syllables and sounds.
Yes.
So good job with that. So the next, we're also going to focus on another behavioral task that helps with her articulation, since this is the most common deficit with hypokinetic dysarthria. So our next area that we're going to target is a behavioral task called exaggerating consonants, and it's also more commonly known as over-articulation. Okay. So this also helps the patient to fully articulate all their consonants and phonemes as well. So the medial and final consonants are the hardest consonants for people that present with hypokinetic dysarthria to articulate. So by focusing on the medial and the final consonants, it helps them improve their overall intelligibility. So what I'm going to have her do is read 2 sentences, and she is going to focus on those. We're going to focus on the final sounds of the words. So I'm going to write. Raylan. So I'm going to write 2 sentences on my sheet of paper here.
Okay.
And I'm going to underline the ending sounds in these words. And what I want you to do is, when you see that word and see the ending sound underlined, I want you to say, like in the word eat, I want you to really articulate and exaggerate that ending sound and eat that t sound. So eat.
Okay.
So really exaggerate that. Eat. Okay. So I want you to read the sentence for me and exaggerate those ending sounds.
Okay. I like to eat cake.
Very good, very good. So you exaggerated those ending sounds to help you really articulate those words in that sentence. Very good. So now we're going to move on to our next task. And so our next task is going to focus on the area of phonation. And because many individuals with hypokinetic dysarthria adduct their vocal folds, they only partially adduct them, so they may have harsh or breathy vocal quality when speaking. And they also may experience reduced loudness. So there are some tasks that can help with this, and one of the tasks is called a hard glottal attack. So with this task, Raylan, what I want you to do is you're going to hold a deep breath, and you're going to bear down. You can just bear down like on the arms of your chair. Okay. And I want you to attempt to phonate a tight ah. So when you bear down, you're going to go ah, ah, and we're going to do that 3 times, okay? All right, ready, go.
Ah.
Good. Very good. So this helped her to really add up those vocal folds. Very good. So the next area that we're going to target is her respiration. So shallow breath support can occur in hypokinetic dysarthria and can cause shortened phrases and decreased loudness in the patient's speech. And it can also contribute to a more breathy quality of their phonation. So the next task that we're going to do is a task called slow and controlled exhalation. And so, Raylan, with this, what I want you to do is you're going to inhale fully, and then you're going to exhale in a slow, steady stream.
Okay.
And each time you do this, I'm going to time each of your exhalations, because with each therapy session, we want your exhalations to get longer and longer.
Okay.
So I'll do an example first. So you're going to breathe in, and you're going to exhale in just a slow and steady stream. Okay. So I'm going to get my timer here, and we're going to time your exhalation. So inhale fully. Now exhale. Very good. Very good. That was very slow and steady. I want you to do it one more time.
Okay.
All right. Remember to sit up straight and inhale fully. And exhale. Slow and steady. Very good. That was longer that time. Very good. So this helps with her breathy quality of phonation. So our last but not least behavioral task that we're going to target is in the area of prosody. And some people with dysarthria, they need to learn to divide their utterances according to normal pauses within and between their sentences. And this will help them slow their rate of speech. So what I'm going to do is I'm going to have my patient here, Raylan. I'm going to have her read a sentence, and she is going to, I have it written out where she's supposed to inhale within the sentence to remind her to inhale. So the more and more we practice this, it will help her when she's just in conversation or reading a story to inhale in a more natural state. So, Raylan, I have these sentences here, and wherever I have the word inhale, I want you to take a deep breath. Not a deep breath, but just a breath.
Mm-hmm.
All right?
In the morning, I went shopping at the store.
Good.
She went there, but I missed her.
One more.
I saw the movie. It was pretty good.
Very good. So this will help you when you are reading or when you are talking with other people to just remember to when we're supposed to naturally pause when we're making sentences or at the end of sentences. It will help you do that better. Okay. So we will continue to practice with that. Awesome. And so that is all of our behavioral tasks that we are going to do today to help us in treating with hypokinetic dysarthria. So that is all, and I thank you for participating.
Yeah, thank you.